This is Sally. She's a 25-year-old woman who loves sports. Yesterday, Sally was in the park playing badminton and was not wearing shoes like she usually does and stepped on a rusty nail. She ended up with a small cut and applied basic first aid to the injury. However, a couple of days later, the cut remained painful, inflamed, and looked infected. Something to keep in mind is that Sally's tetanus immunization is unknown. So what is the correct thing to be done in this situation in order to help Sally? We have 3 professionals here who are going to help guide Sally through the process. First things first, tetanus-prone injuries like this one should always be taken to a hospital or medical centre for assessment by medical staff. So let's ask Dr. Smith what the best treatment option is for this situation.
There are a number of options available to treat tetanus, but it must be understood that vaccination as a prevention strategy is always recommended. However, Sally, since you are not sure about your vaccination status and have been exposed to a potential tetanus-prone wound, the correct treatment option would be to administer tetanus immunoglobulin.
So what is Tetanus Ig-VF and how is it made? Let's ask a scientist from the blood bank.
Tetanus Ig-VF is an immunoglobulin product which contains antibodies against the bacterial toxin produced by Clostridium tetani. Tetanus Ig-VF is made using human plasma donated to the Australian Red Cross Blood Service by volunteer donors. The donor plasma containing a high amount of antibodies against Clostridium tetani is used to make the Tetanus Ig-VF. The plasma is sent to CSL Behring for separation into different components, one of them being the tetanus immunoglobulin. At the point of fractionation, the immunoglobulin is separated out of the plasma using centrifugation and chromatography.
We do recommend passive immunization, preferably using human tetanus immune globulin in situations like Sally's, as it may be necessary for prophylaxis in the case of dirty wounds. Especially since her immunization status is unknown, it is not only used to fight infection as a replacement therapy, but also has anti-inflammatory and immunomodulating effects.
So how exactly will it help in protecting Sally from a tetanus infection?
Tetanus Ig-VF has IgG antibodies against bacterium Clostridium tetani. The immunoglobulin provides passive immunity to people who cannot or have not recently been vaccinated against tetanus and have encountered a tetanus-prone wound. The immunoglobulin is also administered to people who have been completely immunized against tetanus in the last 10 years and have encountered a wound which might have exposed them to tetanus toxin. This will strengthen the immune system in case a tetanus infection occurs.
It is important to note that one dose of the tetanus toxoid only confers a little, if any, long-lasting immunity. A second dose provides protection in 90% of individuals within 2 to 4 weeks, but immunity has been found to be short-lived. A third dose ensures an almost universal protection for at least 5 to 10 years, thus following up with recommended vaccinations are crucial, and you should come back to see us. In 1998, a study analysed the effectiveness of tetanus immunoglobulin in adults presenting with varying stages of tetanus infection. The immunoglobulin significantly retarded the rate of progression, reduced hospital stay, and reduced doses of sedatives, with a significantly lower mortality rate. Similarly, in 2004, a study conducted with 120 patients with human anti-tetanus found those treated with the immunoglobulin showed better clinical progression than those in the control.
That's all really great, but how can we make sure that there are no adverse risks associated with tetanus Ig-VF?
Tetanus immunoglobulin can be administered both intramuscularly and intravenously and is a great treatment option. In this case, intramuscular injection should be given. Mild side effects include pain, inflammation, and stiffness of the muscle surrounding the site of injection. But this commonly occurs with injections in muscle tissue. Other side effects are very uncommon, however, if present, reactions differ from patient to patient. If the severity increases or you are unsure about anything, always contact your doctor. It must also be noted that tetanus immunoglobulin can interfere with the effectiveness of a select number of live vaccines and should be administered with care.
The safety of the immunoglobulin is further ensured by incubation at conditions which significantly reduce viral titers and nanofiltration, which further purifies the final product and removes any viral particles that might be present.
What is the legislation assuring the safety of the product?
It's very important for your safety that legislation-approved products are used. The Human Tissue Act 1983 specifies that only exempt suppliers such as CSL, that is registered under the Therapeutics Good Administration, can supply tetanus immunoglobulin. It also requires the exempt suppliers to act accordingly of donor's consent and follow special regulations of the Act to minimize risk of contamination, ensuring safe supply of blood products. Therapeutic Goods Act 1989 requires the product to be registered on Australian Register of Therapeutic Goods before they can be supplied in, imported or exported from Australia. Tetanus Ig-VF vaccine is registered under the category Prescription Medicines by TGA. TGA laboratories test the products such as Tetanus Ig-VF for quality before a batch is released, following batch release, and periodically. Quality system of the testing laboratories, example, equipment practices, storage facilities, labeling, record keeping, etc. of TGA needs to be regularly audited and accredited by NATA. NATA is Australia's national accreditation body for the accreditation of laboratories, inspection bodies, calibration services, producers of certified reference materials, and proficiency testing scheme providers throughout Australia.
Sally is also thinking about the cost of the tetanus immunoglobulin.
The product is supplied under the National Blood Authority that manages and coordinates arrangements for the supply of blood and blood products and services on behalf of the Australian Government and state and territory governments. So the cost of tetanus immunoglobulin you are receiving today is covered by the NBA. So ultimately it's covered under your health fund.
Now bringing it back to Sally. Because of this guidance and advice given by 3 professionals, any worries she previously had were resolved, and Sally was convinced that this treatment option was the best one for her. As a result, she received the tetanus Ig-VF treatment, and within several days, she is on the road to recovery.